In this case, we are going to see on ultrasound how a partial thrombosis of a fistula vein looks like. The case is of a 57-year-old Turkish female with CKD stage 5 of unknown origin, and she received in 2007 a dialysis fistula. In October this year she presented with pain, redness over the outflow vein. Here we see the picture of the right upper arm with a slight swelling over the outflow vein. On ultrasonography, here we visualize the brachial artery and we see a nice laminar flow within the artery, and we measure the flow through the fistula in this portion of the brachial artery just prior to the AV anastomosis. We have to increase the scale because we see aliasing. We have adapted our angle below 90 degrees, and we see a normal Doppler wave pattern with a pronounced diastolic flow. We measure the volume flow by measuring the time averaged mean velocity, and we give in the diameter in our software program, so we can calculate the volume flow, which is here above 2 liters per minute. So we have a hyperdynamic fistula. We look at the brachial artery in a transverse view, and we go more distally, so towards the hand, while looking for the AV anastomosis. There's a normal laminar flow in the artery, and here we come to the AV anastomosis, and we see some turbulent flow in this area. Turbulent flow does not always have to mean a significant stenosis. We often see turbulence in the area of the anastomosis without influencing the functioning of the AV fistula. So here we have the beginning of the outflow vein, which has a large caliber, probably over 1 centimeter. So it will be easy to cannulate, and we see a normal laminar flow within the vein. So now we go up towards the head, and the vein is not running entirely straight. It's making a turn and it's going further up, and now we can see that there's an hyperechoic zone appearing, which is consistent with a partial thrombosis of the outflow vein. And if we measure it, we can say that it's about a 40% stenosis, and the vein lies superficially. So this partial stenosis, this partial thrombosis, will have caused a thrombophlebitis reaction and gives symptoms like redness and pain over this area. A treatment with an NSAID gel, Voltaren, and with low molecular weight heparin, Clexane, 80 milligrams per day, was started after seeing or after having diagnosed this finding. We followed the cephalic vein further up, and here we are nearly in the axillary region where we see the crossa. The crossa is where the cephalic vein goes into into the deep venous system, the axillary artery, the axillary vein, and there's no problem there. There was no sign of aliasing or stenosis. We look again at this partial thrombosis of the vein in the longitudinal view.